Meantime, here in the state of Indiana today, Indiana unfortunately is breaking record after record as COVID cases surge due to the Omicron variant, and today unfortunately no exception. So let's take a look at the latest data. This is the graph. The State Department of Health reports more than 15,000 new cases just today. That's nearly 23 higher than the previous state record that we set yesterday. Sadly, more Hoosiers are dying with COVID. You can see the trend right there. The state reporting another 150 deaths today. We've been averaging more than 40 deaths a day for about the last month. Indiana trends not isolated. This is what's happening all across the world as the Omicron variant continues to spread. The World Health Organization says there were 41,000 deaths reported around the globe last week, as well as a record 9.5 million new cases of COVID. That is up 71%. And when we see numbers that high, as you can imagine, the demand for testing at an all-time high as well. Today, Rich Nye found that there are people that are coming from surrounding counties, even surrounding states, to a temporary mobile clinic that was set up out east in Shelbyville.
Josh Smith came to the Shelby County Fairgrounds from Columbus to tilt his head back and take the nose swab. He's not feeling great. His wife is a nurse at a hospital, and he knows the potential dangers of COVID-19.
I want to keep my family safe. I've got older relatives. I've got some that's died from it, so you definitely want to not be in contact with those people if you're sick. And I got nieces and nephews that I love, so I don't want to get anybody sick.
The state brought this mobile clinic to Shelby County to meet the high demand for testing. It's only open 4 days through Saturday, 12 to 8. There has been quite a line, but right now, you can get a test in about 15 minutes. Anyone exposed to someone who tested positive or feeling COVID symptoms is welcome to make an appointment or walk in.
They need to be tested because if they're sick and they're going out into the public, they're infecting other individuals. So getting tested, following the guidelines for quarantine and isolation, and then getting vaccinated. If they're negative, go get vaccinated so that way it'll help.
This mother and daughter are feeling okay, but another family member was exposed to COVID at work.
Because I want to make sure that everybody in the household is safe. I don't want to go around and infect no one else, so that's why I come and get tested.
The tests you have to stick your nose up at, then wait for results by email.
Well, the new rule that was put in place limits who can get a rapid test is really giving some of the county health departments a break. Earlier this week, you might recall the state of Indiana limited the free rapid testing that's at state and local sites to those who are 18 or younger and those who are 50 and older that present with symptoms. Now, the Madison County Health Department today telling 13 News those restrictions make it a lot more manageable for their staff to treat patients with appointments and also see some new walk-ins. That's because the majority of the people who were seeking those rapid test results were between the ages of 18 and 49. There are many free testing sites all around the state, but many are only accepting appointments at this time. So if you want to learn more about when you can get tested, you can do so on the state's website, and we'll link you to that from our website from WTHR.com/coronavirus.